Speaking of Hickenlooper, Governor Hickenlooper joined a group of governors this week to testify in front of a U.S. Senate committee on stabilizing the nation's healthcare markets. Meanwhile, the Colorado Division of Insurance announced on Wednesday that rates will see a 27.6% premium increase in 2018. Eric, what did you think about the testimony before the legislature?
Well, I mean, this has become John Hickenlooper's issue, which would amaze a lot of people if you dial the clock back 4 months or 6 months, much less a few years, because they never saw John Hickenlooper have any particular interest in healthcare issues or devote much time to it. But John Hickenlooper has picked this issue to really develop and expand his national profile, and in tandem, particularly with Governor Kasich, John Kasich of Ohio, to build upon the bipartisan brand that Hickenlooper's already been famous for. I think, congressional testimony is congressional testimony. He obviously acquitted himself fine. Did he move the needle? Probably not. We're stuck with the system. The current system is broken. We can rally around Obamacare all we want. It's broken. That does not mean the Republican alternative was the right fix. I think you have a hard time even finding Republicans to make that case, much less the public at large. At some point, there has to be some kind of serious bipartisan solution, and Kasich and Hickenlooper are trying to start that debate or give fuel to that process. There's a hypocrisy to Democrats now yelling about the importance of bipartisanship here, given that Obamacare passed 8 years ago without a single Republican vote in either the House or the Senate. So Democrats, when they had the power, did it in a purely partisan way. But at some point, somebody has to blink here and come to the table in a serious way, much more serious than the Lord knows Donald Trump and the White House have been capable of, and come up with some solution. But again, just like immigration, where do you find that middle ground? Democrats are moving further and further towards single-payer proposals. Republicans, Lord knows where they are on healthcare issues, but anything that reeks of Obamacare is toxic. I don't know where you find the middle.
Justine, can you help them find the middle?
Healthcare is exhausting, and it's been exhausting for us for several years now to try to find solutions to these issues. I would agree there are lots of issues that we need to fix with the current healthcare plan, with the Affordable Health Care Act, and that's, those things are laid out. For example, with insurance premiums increasing here in Colorado, how do we fix the insurance companies? And how do we fix access to health care? How do we do this? I mean, I have no idea. It's become mind-boggling. I'm happy to see them sitting down and trying to bring some bipartisan resolution to all of these issues. Considering the last few months with the attempts to repeal and replace and all of the chaos that's been going on, I don't feel very optimistic about this particular issue and any solution moving forward.
Well, Hickenlooper and Kasich certainly have played well in the media. How do you think they played before Congress?
Probably less enthusiastic than their nighttime newsreels in the previous weeks. But it's still, I think, a compelling concept. How do we move this conversation forward? And, this may not be the answer for it, but there's no doubt in my mind that this country has to continue having this conversation. One of the things I found interesting when I was looking at the Colorado rates and who the increase in premiums would affect, it's only about 8% of the people who have insurance in Colorado would be affected by that. So that's only 8% of the people who are sort of participating in these exchanges. More than 50% of our insured people are getting it through their employers. Now, that necessarily isn't a bad thing. I think a lot of people do that, obviously, more than 50% of people. But I think I've heard change in sort of rhetoric around this. I hear a lot of people these days talking about how staying in a job is connected to health care. And every time I hear someone complain about that, I think about, wait, isn't this what the ACA was supposed to address? Weren't we supposed to have more than 8% of people in these exchanges? Weren't these exchanges supposed to be affordable? And then you dig into the numbers a little more, and that 20+ increase in premiums, the actual person isn't going to pay that per se. There's credits and other things. And then I just start thinking about all those, you hear about a couple going into a hospital for a delivery, and they come out with this, bill that's 30 pages long and includes these line items that they had no idea they were paying for. And I'm like, well, it starts there and it goes all the way up to our premiums, and it goes to Washington, D.C. as well. This is such a mess at this point, but there's no doubt that we have to find a way to do it. So I applaud any effort, bipartisan, at any level, that tries to get to the bottom of what those things are.
And let's hope they come out with a baby as well as that big bill. Roger, do you see that the Republicans can work with the Democrats to find common ground on this?
Well, you know, somebody's going to have to be the adult in the room at some point, right? I don't know that it's this president. And actually, the president may be the reason the others unite to come up with a solution. It really may be truly the thing that they all fight for or against. This president has decided not to be a leader in healthcare and has actually muddied the waters to a point where now everybody's confused. We saw early on that Republicans were afraid to say anything against this president because he is so volatile on the other side. So any kind of reaching out and grabbing a hand of a Democrat to try to fix Obamacare, God forbid, or be able to repeal it and put somebody else in better, was not met with enthusiasm at all. The Kasich-Hickenlooper plan, you know, that's difficult. I watched the testimony. It looked like to me that our governor was patted on the head and told to go back to Colorado. You know, thank you for playing for the big boys for a little while, but go away. For the mandates to still be in this plan, it's a non-starter for Republicans. That's a real problem for us. So there's some issues in that plan. The only reason they got any attention at all is because it was a Republican and a Democrat. I would say a Republican light and a Democrat that were joining forces.